My name is Jegan Krishnan. I'm a professor of orthopedic surgery, and I've been doing joint replacement surgery for nearly 30 years. And it's my privilege to help you through your joint replacement surgery and speedy recovery. I'd like to talk you through shoulder joint replacement. Most of you would have a significant arthritis affecting the shoulder joint. So this is a shoulder blade, and this is the top of your humerus bone, and this is the arthritic cartilage in your joint. So the bone rubbing on the bone is what's causing a lot of your pain. So what we do in the surgery is replace the worn out ball and cup arrangement in the shoulder joint. And the implant that we use is one that has the ball that is fixed into the shoulder blade, and then a cup arrangement that's built on to your humerus bone with metal and plastic as well. So the idea is to alleviate the pain by resurfacing the implant, the surface of the joint. Once you've come in to the theatre setup, the anaesthetist will start putting needles in and around your neck, and these are to block the nerves to get and control the pain that you will have post-operatively. So following these nerve blocks, when you wake up, you must probably feel that you've got a dead arm. So don't be alarmed, and that's entirely as part of the pain relief protocol for your surgery to keep you comfortable. Following the surgery, when you wake up, there will be a tube, a drainage tube coming from the joint to drain any excess blood. This reduces the amount of swelling in the joint and therefore also helps with pain reduction following the surgery. After this, your arm will also be then placed in a sling when we transfer you to your bed, and then you will be transferred to recovery. In recovery, you will be there for an hour and a half, where the nursing staff will take all your observations to make sure you're stable and recovered from the surgery and attend to your pain relief. And also during that period, an X-ray will be taken of your shoulder to make sure that the implants are properly aligned. Following this, you will be then transferred to the ward, and because you will be very comfortable in the sling and with the arm block, you will be able to sit out of bed reasonably quickly and commence mobilizing around your bed. And this will start pretty much 4 hours or so after the surgery. Your arm will regain sensation and muscle tone in about a 12 to 18 hour period. So the next morning after the surgery, by midday, you should be having sensation coming back to your shoulder and your arm. And this is when the physios will start you through an exercise program. Because of the type of implant we use, which is very stable, we're very confident for you to start moving and using your shoulder within your comfort level. So initially, you'll be able to get your hand to your mouth and some gentle, what we call pendular exercises of your shoulder. You will be in hospital for 2 to 3 days, and when you leave us, your arm will be in a sling, and then our physiotherapist will commence with your rehabilitation program. You will be given antibiotics during and after the surgery to reduce any risk of infection, and you will be given significant pain relief to go home with to make sure you're comfortable most of the time. And it is very important that you take this pain relief medication regularly so that you can stay on top of the pain. So don't wait for the pain to come before you take your medication. And this regular pain relief regime should be for about 2 to 3 weeks. During that 2 to 3 week period, you can come out of the sling on a regular basis and do the exercises that the physios take you through. And generally around about 4 to 6 weeks time, you've regained a reasonable functional range of motion of your shoulder to be able to shower yourself and also to do certain activities at a tabletop level. The physios will take you through an exercise and strengthening program so that you can start to work at moving your arm at or above shoulder level, and that will commence around about that 2 to 6 week period. And generally the recovery is reasonably quick with the shoulder because the pain relief is very good, and the range of motion that you can get is also very good early. So you only need a sling for your comfort and support for anything between 2 to 4 weeks, and generally after that most patients don't require a sling for any comfort. It will take you somewhere between 4 to 6 months to regain movement, and that gain in movement will continue for anything up to 12 months after the surgery. So it does require you to be diligent with the exercise program and the physiotherapy program that we've organized for you. In your immediate post-op care, after you go home, you will see our nurse at about 2 weeks to check your wounds, and there's no sutures to be removed because they're dissolving sutures. I will see you at approximately 6 to 8 weeks following the surgery, and then again 3 months following the surgery. Your last review with me will most probably be at 12 months following the surgery. The shoulders do take that 8 to 12 months to make a full recovery in terms of range of motion. So you have to be patient and also diligent with your exercise program.